I think PsychU offers an opportunity for all types of practitioners, whether it's physicians, pharmacists, nurses, and patients for that matter, to really gain insight and expertise, insight and guidance, general information on various aspects of mental health disease in the market today.
PsychU is, I think, a really unique and really exciting thing to be part of. It's, of course, first and foremost a community. It's a community of people who provide care, who are sometimes people who are also receiving care, payers. I think one of the nicest things about it is it's not trying to be really too specific about who it is open to. It's not just the people doing the medication. It's not just the people doing therapy. It's not just science geeks like me. It's a really pretty broad community, which I really enjoy.
PsychU, to me, is an opportunity for healthcare providers to all come together to work as one treatment team for those suffering from mental illness. I think it's the opportunity for us to learn and collaborate together and grow and help the patients that we also care so deeply about.
PsychU is a great place to get information on common clinical issues, no matter where you are in the sort of multidisciplinary kind of world. If you're doing social work, if you're doing licensed professional counseling, if you're a primary care clinician or a psychiatrist, there's a place and something for everyone. And PsychU is, I think, on the forefront of punching forward to answer the tough questions. I mean, some of the material there deals with things that are true but may be sensitive. And so the courage, I think, of the site is one of the things that I really like about the site. The fact that PsychU has been willing to really talk truly and in very honest ways to lots of different people and give clinically useful information to lots of folks.
For me, it's a great platform to get in touch with colleagues, other psychiatrists, other healthcare providers, to interact with them, to get to know what they want and what they think is important, and to share some of our knowledge.
So PsychU is a way of finding out about different illness states and treatments that is kind of convenient and online and on demand.
What I've done is really use that as a way to develop my knowledge base in the mental health space gradually by going through some of the modules and just feeling as though I'm getting a better understanding of where opportunities might exist, and perhaps with my role in the Academy of Managed Care Pharmacy, an opportunity to see where maybe some mental health programs or services could be integrated.
Some of the things that are on the forefront, being tested out, I need recent information. I need to hear practitioners of those disciplines speak to what strengths they bring to the treatment community. When clinicians ask me for journal articles or relevant information on stigma, suicide, psychopharmacology, counseling, interdisciplinary kinds of treatment and the advantages of integrating care and collaboration, I know where I can send them.
It really was a rare opportunity to address a big challenge in the field, which is mental health is far behind physical health in terms of the ability to not only know what the standard of care is, but actually make that happen in the field. So the whole purpose of PsychU is really to encourage that collaboration, use the content as the fuel, and then encourage people not only to understand what's best practice, but to actually try to move that out in the field. What we hope is that by having more collaboration with organizations out there, having a broader footprint, hitting our 50,000 mark in terms of membership, that we will collectively have more and more impact.
I think this is just the start. There's very much more we need to do. We need to continue doing what we do, focusing on gaps in information, gaps in knowledge, but more importantly, we need our community to be more engaged, work more collaboratively, and to address those key issues that still are impacting the delivery of care, because our end goal is to improve patient lives. Our goal can only be accomplished if we work collectively. So we actually have to ensure this community is a living, functioning community that's a problem-solving community. Only then can we bring about our goal of improving patient lives together.
And it's an opportunity just to give back. I mean, we've done a number of different initiatives, stigma, suicide. We've talked about technology, and these are important just to see the impact that we make. And it's a small impact, but I think it's an important impact. Really just keeps me going.